Deputy President Paul Mashatile officially kicking off the G20 Social Summit, which is the flagship platform for integrating civil society voices into the G20 decision-making process earlier today. And that's where we find my colleague Thembekile, who is on standby there at the Birchwood Hotel, just to paint a picture for us of how the day went and some of the important conversations that were taking place. Thembekile?
Bongiwe, good evening. You say how the conversations went, and the conversations, in fact, are continuing here at the Birchwood Hotel at the G20 Social Summit. In fact, among the people participating in the current discussions here are the likes of Minister Gayton McKenzie, the Minister for Arts and Culture as well as Sport, as is the Minister for Water and Sanitation, Phemi Majodina. So vast, then, is the array of topics that are being discussed at a time when civil society and communities have been brought in to participate in the conversation that are happening ahead of the G20 Leaders Summit this coming weekend here in South Africa. And one of the people who is attending, in fact, all the way from Geneva, Switzerland, is Claudia Ahumada. She is an advocacy manager with the Global Fund. They work in the healthcare space, and she joins us now, in fact, to speak to us. Claudia, welcome to SABC News. You are here as one of the people very passionate about the funding of global healthcare. Give us a picture of just the extent, the level of need right now, and where that inequality manifests most.
So I would say that if I were to describe the level of funding for health, desperate is the word that we should use. The needs of our communities are so urgent, so desperate. And especially if you think about the work that the Global Fund does, we raise funds for HIV, tuberculosis, malaria to support countries and communities to strengthen their health systems. We've made amazing progress, saved, imagine, 70 million lives already, but we know that progress is so fragile. If the funding stops now, if funding suddenly halts or diminishes, it's lives lost. So it's not just about, oh, can we raise X amount of money, but are we committed to continue to save lives? Are we continue to ensure that countries can have strong health systems?
And why is there this apparent slowdown in the amount of money that is being given to fund healthcare, to fight TB, to fight malaria, in some cases, in some countries, even to fund HIV/AIDS programs as per the Trump funding withdrawal?
You know, one of the things that happens is that there's a big focus now on African leadership and on African countries taking responsibility for the health of their people. And that's fantastic. That is absolutely what we all want. It's the country ownership principle that the Global Fund stands for. But that cannot be an excuse for donors to withdraw funds, which unfortunately is sometimes what we see. They say, okay, we are ready to transition out. But what we need to do is listen to that same African leadership that is telling the world very clearly through the Social Summit, through the G20, that we need time, that for that transition to be sustainable, we need to continue to provide funding so that eventually, of course, there will be full African leadership and ownership of their health systems.
And what are the consequences of not including or listening to African voices in the conversation about the health of African people?
The consequence, quite frankly, it's death. It's that simple. It is death. From our calculations in the Global Fund, if we are able together as a partnership to raise the funds that are needed, we can save 23 million more lives. On the contrary, if we do not succeed in doing that, those are lives that are lost. And that simply isn't a loss that can be acceptable to the world, so we need to be listening. We need to be stepping up and providing bold, courageous funds, because the lives of every single one of those people matters, and the lives of the people in our African countries need to be supported.
And where do you see the highest number of lives being lost right now in Africa compared to the rest of the world? And what would it take to turn that around?
So it's absolutely in Africa where the need continues to be greatest. We have seen tremendous progress, but 70% of the Global Fund's funding is invested in Africa, partly because the need is greatest, but also on the flip side because there's such opportunity. We have seen African leaders step up. We have seen communities across Africa do incredible work. But there are areas and communities where the need is still very big. And where
are those communities the worst affected parts of the continent?
Young people. No, Africa has the largest youth demographic in the world. Opportunity, risk at the same time. Young women in particular, if we look at HIV, for example, the rates of HIV are growing exponentially, and that is something that we know how to prevent.
It's interesting because you paint a picture of a very troubling situation, right? But when you look at even the G20's own report on inequality, which was handed to President Cyril Ramaphosa as host just a few weeks ago, it says that world governments and all of us in general are in fact at the moment spending less and less of healthcare. Why does that happen when the data is pointing to the need to do the opposite?
So you're right, because the data is very powerful in saying that the need is there. So it's not about data. What it is political will. We need that political will to be sustained. We cannot be a generation of leaders that says, we have invested in health long enough and now we're done. We heard today in the opening of the Social Summit how health is at the heart of people's right to live. You cannot live if you are not healthy. So this is not an area that can go out of fashion. This is not an area where our leaders can tire of investing. Quite the contrary. We need to step up our investment. We need to adjust our investment to the needs of our communities. And we need more partners to come along, including, of course, the private sector.
So on that note then, you mentioned the issues, the concerns perhaps around leadership in countries where there may not be the levels of governance that are required. Yes, it comes up even in that G20 Commission report. But ultimately, is that the only reason why the private sector is not fully coming to the party?
Well, I would debate a little bit. Is the private sector coming to the party? I'm hopeful. For the Global Fund replenishment, which we are celebrating now on Friday here in Johannesburg, we have had greater investment from private sector than ever before. So there is a pathway. Do we need more? Absolutely yes. Is there room for the private sector to give more? Again, absolutely yes. But there is a positive trend, which through the Global Fund partnership, we are looking to make even deeper.
So what is your target then? How much do you have in the kitty and how much do you need?
Well, you know, I always like to talk less about how much money we have and what we can do with it. Because people hear of billions of dollars and you think, ooh, that's a lot of money. And in reality, don't think about the dollars, think about what you can do for your community, for your country, for the world. And what we can do with the money that we will raise is save 23 million more lives. Show me one person that thinks 23 million lives are not valuable.
23 million more lives that could be saved with better investment in healthcare. Where does that leave us if there is such a level of underfunding, let's say, in terms of global preparation for another pandemic? Because when COVID came around in 2020, much of the world was caught with its pants down, right? And the fear now is that we're not putting down the foundations to ensure that there is swift response next time something similar happens. And how soon that might be, we don't even know.
That's such a good point, because with COVID, we all saw the world come for a standstill. We saw our economies falter. We saw our communities dying. And yet, a few years down the road, we seem to have forgotten, and we cannot forget. Because what the evidence shows again is that it's not a matter of if another pandemic is going to occur, it is a matter of when. And we know now how to be prepared. The Global Fund has shown also that we are able to deploy resources, partners, communities quickly in the case of a new pandemic. But again, these things require sustained funding. And this is why our replenishment summit this Friday is so urgent. And we need governments, private sector, philanthropies to all step up and make very strong, courageous pledges.
Lastly, and very briefly then, how does a gathering such as the G20 overall and the Social Summit where we are tonight help to achieve that?
It helps absolutely by setting the tone. The fact that we are having the G20 here in South Africa, the first time on African soil, is incredibly powerful as a political message. The fact that the replenishment summit itself on Friday is co-hosted both by the government of South Africa and the government of the United Kingdom, that is a first to be co-hosted, North and South together in full partnership. Sets a powerful message that we are seeing resonate throughout the Social Summit and the G20.
Claudia Ahumada, good to talk to you, Advocacy Manager with the Global Fund. They are focused on especially the raising of funds to help the world battle things like malaria, tuberculosis as well, which remain huge problems on the African continent. On Friday, they have a summit on the 21st that is meant to help replenish, if you will, the global funding for these problems. And that is it from us, at least for now, here at the Global Summit, or the Global Social Summit, the G20 Social Summit it is, in fact. Over to you, Wangiwe.
All right, my colleague there, Thembekile, out in Boksburg for us.